Well, ladies and gentlemen, we are meeting here today to consider the matter of Dr. Mandy Cohen's appointment to the office of Secretary of the North Carolina Department of Health and Human Services. As you know, a three-judge panel recently affirmed our authority to hold these hearings. We think this is the right decision under the Constitution and a victory for the public. During today's meetings, the members will hopefully have a thorough, respectful, and open discussion with Dr. Cohen. Assuming we finish this morning, and by the way, we understand that the House has this room engaged at 11 o'clock, so we're going to work as diligently as we can. The plan will be to vote as a committee on whether to recommend Dr. Cohen's confirmation to the Nominations Committee. The committee chairs previously gave Dr. Cohen a list of potential questions, so those questions will be open to discussion as well as other questions that members may have. Our goals for today are to inform ourselves as to whether Dr. Cohen is well qualified for the office, whether she has any conflicts of interest, and whether she intends to follow the law. The chair has received 4 letters of recommendation on behalf of Dr. Cohen. Without objection, these letters will be included in the record of these proceedings. Is there any objection to that? Seeing none, that's ordered. We have a few ground rules that are a little bit different than our normal committee meetings that I'd like to go through with you right now. We have a court reporter, Ms. Linda Garrett, who is back over to my right-hand side, who will be recording the proceedings. So I ask that any members who wish to speak to the committee or to Dr. Cohen will speak clearly and don't talk over each other. You will need to direct your question to the chair first, then I will direct Dr. Cohen to answer. Dr. Cohen, I invite you, first of all, I welcome you here, and I invite you to stand for the oath to be administered to you by Ms. Linda Garrett, and she will administer the oath from where she is. If you will stand and raise your hand.
Good morning, Dr. Cohen. Do you swear or affirm that the testimony you are about to give will be the truth, the whole truth, and nothing but the truth?
Thank you, Dr. Cohen. Thank you, Ms. Garrett. I believe we're ready to get started. And first of all, I'd like to invite Dr. Cohen to make any opening statement that she might have.
Well, good morning. And thank you so much for having me here. Thank you to the whole committee, and thank you, Chairman Pate, Chairman Heiss, Chairman Krovic. I appreciate the opportunity to share a bit about who I am and outline the opportunities I see for the future. I couldn't be more excited to serve the people of North Carolina as the Secretary of Health and Human Services. I have dedicated my life to medicine and to public service, and I'm humbled by the tremendous responsibility and ready to roll up my sleeves. The department touches the lives of every resident of our state, and I'm happy to bring my background in medicine, in policy, and leading large, complex organization to build a healthier North Carolina. I wouldn't be sitting here today if not for my mom. She was one of the first nurse practitioners in New York State more than 40 years ago. She still works to this day in an emergency room at night. And it was through my mom's eyes where I first saw the power of medicine to touch people's lives, but it was also where I learned about the broken parts of the healthcare system. As we all know, often those broken parts show up and are magnified in the emergency room. So I entered medical school with the aspiration of bringing together clinical practice of medicine and the need for system change. And so after completing my training as a primary care doctor, my first job was at the Veterans Hospital in Washington, D.C. I was caring for women veterans while also working on policies to better integrate the care of women into the everyday operations of the larger VA health system across the country. And then, as you know, in the last 6 years, I've had the opportunity to hold several roles at the Centers for Medicare and Medicaid Services, or CMS. I joined CMS initially to work on new ways to pay for care through Medicare that would drive better care and smarter spending through the whole healthcare system. We stood up the first Medicare accountable care organizations, bundled payment initiatives, and new ways of paying for primary care. And then in 2013, when CMS experienced a major public crisis with the failure of the healthcare.gov website, my career took a different turn. I was pulled to work on the federal marketplace, and within a few months, was asked to take over as interim director. It was through this experience, and then being promoted to Chief Operating Officer and Chief of Staff for the whole CMS organization, where I learned to run a large, highly complex organization. It was where I learned to lead by cultivating issue-based teamwork, proactive communication, transparency, clear accountability, and excellence in operational execution. I work closely and constructively with a diverse array of stakeholders, members of Congress on both sides of the aisle, and I'm excited to bring those leadership lessons, as well as my policy and clinical knowledge, to bear here in North Carolina. Now, over the last 8 weeks, I've been doing a lot of listening and learning. I've traveled around the state to Burke County, to Wayne, roundtables in High Point, Mecklenburg, back here in Raleigh. I've had many one-on-one meetings here at the General Assembly with other key stakeholders, and I'm seeking to understand different perspectives and search for common ground. Having engaged in these conversations, I wanted to briefly share with you 3 areas of need that I plan to focus on in the coming months. First, as I've discussed with many of you, one of my primary areas of focus is the opioid crisis. It's ravaging our communities despite the hard work of many. DHHS must work in a more coordinated, focused, and collaborative way to address this crisis. I've already sent a letter to every prescriber in North Carolina asking for their assistance to help end this crisis, as addiction can often start with our own prescription pads. But that isn't the only solution. We need to focus on prevention and provide more access to treatment and ongoing recovery. I applaud this committee's work and the attention to this issue, and I look forward to working with you on it. I'm also focused on the changes afoot in the Medicaid system in North Carolina. The planned move to managed care has galvanized the healthcare community in exciting ways, and there are opportunities to drive more value and deliver better care to those whom the program serves. Lastly, I'm focused on accelerating improvement in the health and well-being of infants and young children, whether through direct health care services, child care, pre-K, early childhood education programs, or focusing on keeping at-risk children safe. We must have children get the best start in life, no matter where they live. Beyond these 3 core areas, there's a lot of other critical work going on at the department. I'm very focused on the mental health system and how we can make improvements. We have critical IT projects that need focused execution. I see a lot of opportunity around data and analytics. And I'm also looking at how we get more value out of every dollar we spend in both healthcare and social services by linking the social determinants of health to the delivery of healthcare. And so to close, I wanted to end on a personal note. I take my commitment to the people of North Carolina and this role very seriously. As many of you know, my husband and I have purchased a home here in Raleigh, moved our 2 young daughters, ages 2.5 and 5 here, so that I could devote myself to this endeavor. I'm a pragmatic, solution-oriented leader who's looking to partner with you to find common ground. I've managed difficult organizational change across large, complex organizations, and I'm ready for this challenge. The future here in North Carolina is bright, and I look forward to working with you all as we build a healthier North Carolina together, and I look forward to your questions. Thank you.
Thank you, Dr. Cohen. We appreciate your presence and appreciate your remarks. This time I'm going to open up to members of the committee for their line of questioning. We have several questions that were presented to you earlier, and we're going to follow that order as we move from here. First, I'll recognize Senator Harrington for her questions about your qualifications.
Thank you,
Senator
Mr. Chair.
Harrington.
Thank you for being here, Dr. Cohen. We very much appreciate it. And I appreciated that you made an appointment and came by my office and met with me last week as well. And you did receive a list of questions from the committee, and do you have any written responses that you would like to give the committee?
Not at this time, but happy to answer questions.
Thank you. Can you elaborate on your undergraduate and postgraduate work? For example, what degrees you have obtained?
Sure. I did my undergraduate work at Cornell University. I was a policy analysis major there with a focus on health. Then I went to Yale for medical school, got my medical degree there, while at the same time also got my master's in public health at Harvard in a combined program. So in 5 years, I had an MD and an MPH.
Thank you. Follow-up?
Yes, go ahead.
Scholarships, fellowships, honorary degrees, awards. Can you give us some information on that, please?
Sure. So in 2015, Modern Healthcare, which is a healthcare publication, named me the 2015 up-and-comer for my role at the federal level. This year, Modern Healthcare named me one of 10 women to watch in healthcare. So those are some awards. As I can say, I'm embarrassed talking about my awards, but I think those are the ones that come to top of mind.
Thank you. Follow-up, please.
Follow up, please.
Any outside organizations where you have affiliations or memberships or serve in a leadership role?
I'm a member of the American College of Physicians, which is an organization that represents internists, which is my medical background.
Follow-up.
Yes.
Published materials you've written, co-written, or recorded, or those, including those published on the internet?
So I've testified a number of times in front of Congress, and so those testimonies will be recorded and published. I don't believe that I've written anything I shouldn't say that. So early on in my medical career, when I was doing more research, there's a number of research publications around HIV and AIDS in Africa. I did some work in South Africa early on, and I presented at a number of research conferences there, and I published some work around quality metrics and how academic institutions were using quality metrics. At this time, it's now been 12 or 13 years, so that research has now been eclipsed, but in the past.
Thank you. This is one more follow-up, and this is my last question, Mr. Chair.
Yes.
Can you share any information on courses or classes that you've taught?
So while training at Mass General in Boston as an internist, we supervise medical students, and I taught a number of courses while there. I think they give us some professorship title, I can't remember exactly. So taught a number of classes there, also did some adjunct teaching while we were in DC, talking about the healthcare system, about how Medicare and Medicaid work, and about how payment change would change the delivery of healthcare system, and I think those are a number of courses. Thank you.
Senator Krawick, you are recognized to ask any line of questions concerning potential conflicts of interest.
Thank you, Mr. Chairman. Thank you, Dr. Cohen. Thank you for being here, and welcome to North Carolina.
Thank you so
And
much.
I, too, want to take this opportunity to thank you for taking time out of your busy schedule to come visit with me, answer any questions or concerns that I had, and I appreciate that very much. And I understand that you have severed all of your ties with former employers, organizations, firms, that type of thing. But has anyone made you a commitment for a job offer or any opportunities after you leave your government service here?
No, ma'am.
Thank you. Follow up, Mr. Chairman.
Yes.
Do you expect to serve your full term here in North Carolina?
I do.
Thank you. Follow up, Mr. Chairman.
Yes, you had the floor.
Last follow-up. Do you have any plans or commitments or any agreements to pursue any outside employment, paid or unpaid, with or without any compensation during your service here as secretary?
No, ma'am.
Thank you very much. Thank you, Mr. Chairman.
Senator Ballard.
Hi, good morning. I actually had a question in follow-up to Senator Harrington and was just curious if you still maintain an active medical license, and if not, at what point has that expired or what your plans are?
Great question. So no, I don't have an active medical license right now. I was seeing patients in Washington, D.C. essentially until I had my 2 girls, and my career at that point had advanced, and I'd have a lot of promotions, and so I'm not actively seeing patients, so I've let the license go into, not lapse, but into a state of suspension. Thank you. I am still boarded in internal medicine, but I don't have an active medical license.
Senator Heiss.
Thank you, Mr. Chairman, members of the committee. Going to follow up some questions on the concept of willingness to follow the law, but before I get to those, I did want to ask, if for the record, if you could verify the date for us that you were sworn in to become secretary.
Oh, I want to say it was January 23rd. I think I remember because it was the day before my daughter's 5th birthday, so January 23rd.
Thank you very much. I guess where I'll start on this, and just some things we've experienced kind of up to this point. In 2012, the Supreme Court ruled that states could not be forced to expand Medicaid. And after that, this General Assembly, I believe 3 times, enacted laws that prohibit the department from expanding Medicaid without the approval of the legislature. Although we did give some new authorities to the Secretary, that was one of the things we kept with the General Assembly. Earlier this year, Governor Cooper chose to ignore the law and work with the Obama administration in its final weeks to rush a massive expansion of Medicare. My first question is, do you agree that attempting to expand Medicaid without the approval of the legislature is a violation of North Carolina law?
So, you know, I'm not the lawyer, but my understanding of the law here is there are multiple steps in the process. One of those steps would be an interaction with CMS in terms of approval of either a waiver or a SPA in terms of changing eligibility. But my understanding is also that there'd need to be a change, a change here in the law in terms of raising any state share. And so you can't have both of those steps. You need to have both of those steps in order to move forward. So my understanding is, that there wouldn't have been a way to move forward on changing any of the eligibility requirements without coming back here to the General Assembly.
Follow up. So
Yes.
just to clarify, in the future, it would be your opinion that before you or your department could submit any waiver to CMS to expand the Medicaid population, it would require action of the General Assembly?
As you and I have talked a number of times, I want to make sure that we are having an open dialogue about the things that I'm learning about the department, that you are seeing at the department, and making sure that we can work together on the things that we, where there is common ground. And that's really what I'm focusing on. And I think there is a lot of alignment. We've talked a fair amount about how to make the program stronger, and I'm very heartened by that, and I think that there's a lot of opportunity for us to work there.
Let me take this to a direct question in the same area. Were you ever contacted by anyone in the state of North Carolina regarding the expansion of Medicaid or that particular waiver prior to accepting this position and coming to North Carolina, or prior to being sworn into this position?
Yeah, I appreciate that question. So CMS actually has some very strict recusal rules. And so even when you're entertaining a job outside of CMS that may still be in the healthcare space, you are required to recuse yourself. So I was in the interview process in the December timeframe here for this role. And so I was recused from all things North Carolina. And at CMS, they're quite strict about that. That means no attending any meetings where North Carolina is discussed. No reading of materials would come into, a briefing book, and even folks monitor, my calendar and such. So I was not part of any discussions related to North Carolina prior to, during that period of time, frankly, from the time I started interviewing until I ended my role with the federal government. I was reading about it in the newspaper like everyone else.
Follow up again. To move to a little different subject area, even one that we may agree on the outcome, but 2 years ago, the legislature required DHS to stop making GME, or graduate medical education, payments as an add-on to the base rate. Last year, the department requested some flexibility in those funds to continue the GME payments, but never made any request for additional funds. And so the requirement there was that they go to OSBM and be certified that they had sufficient funds to make that request. And in October, I think the 27th, the department received a directive from OSBM that they did not have, that it could not certify that they had sufficient funds. But having failed to certify that request, I think state law would be clear that it requires that be submitted. We have not seen that as of this point, and I wondered if you could give your opinion on what the appropriate role of the department is, understanding that General Assembly may, in consultation, take a different action.
I think this is a great example where open dialogue between our department, this committee, the General Assembly is really important. What I would say is that our team on the Medicaid side has moved forward with complying with the law, including even a couple weeks ago posting our intent to need to move forward with the SPA, even though we are continue to have dialogue about are there ways for us to continue GME funding, and we are working on technical language together to make that change, because I've appreciated being able to have that open dialogue and share sort of what are the issues that we are seeing with rural hospitals and access to doctors in rural areas, and how GME can play an important role there. So we want to always follow the law, which is why we've taken steps to do that. We are hoping to be able to make those corrections in coordination with you before we have to submit that SPA and before we have to take action, because I think we've come to an agreement about why and how we could move forward in that area.
And just one final area to question on. Our current reform law says that once we begin capitation, 4 years after that time, that our LME MCOs will be absorbed into the existing, at that time, prepaid health plans. Is that a policy, I guess, do you agree with the policy decision, and is that something you continue to plan for and move for the dissolvement of LME MCOs?
So I've been learning a lot about the mental health system over the last 8 weeks, and I've heard a lot of frustration with the current system. And I would say my thinking is still evolving on exactly the right timing, exact right solution. But what I would say is that I want to make sure that those with mental illness aren't left to the side while we're doing this advancement in the Medicaid program, and we're innovating and we're bringing new tools and ways to manage populations to the physical health side. My concern is not having those folks who are some of our most needy and most vulnerable not be able to be part of of that transformation and improvement in the system. And so, and my thinking is very much shaped by my past experience delivering primary care at the VA. It is a place where the VA spent nearly a decade working very hard to integrate physical and mental health together. And when I was practicing primary care there, I was co-located with behavioral health specialists, sometimes psychiatrists, social workers, therapists, others, because of the high incidence of mental illness in the veteran population. And it was great care for my patients because we could serve them in one visit, no matter what the issue was. I became a better doctor because I was co-located with folks who worked in behavioral health, and I was able to glean a lot of knowledge for them. And it was also better care for patients. So, I am thinking about how do we best serve that population. And so I hope that we can drive forward in innovation and integrated care in that population as quickly as possible.
Thank you very much. I appreciate the willingness and work you've done to this point to meet with individual committee members and discuss this, and look forward to this.
Thank you, Senator.